Hi, welcome to my presentation and thank you for coming. My name is Jacqueline Thoet and I'm a senior economics major here at Villanova. For my project, I set out to examine how differences in policies between states affects people's industries, affects people's mobility in 4 states: New York, Pennsylvania, South Carolina, and Maryland. So for my research project, I had 2 main goals that I was pursuing. The first was, to what extent did reopening industries change people's mobility? So I will investigate this research question for the states that I previously mentioned by tracking mobility data at a daily frequency. My second research question is, what are the determinants of changes in mobility during the pandemic? So we have economic determinants where certain groups are more at risk for COVID-19 due to differences in demographics. We have the impact of weather, namely temperature, and we have a comparison of weekends versus weekdays. So now I'd like to talk about how I used Falvey's Resources. So I mainly used Falvey's Resources for the literature review section of my paper. On Falvey's website, they have a very helpful subject guides by different majors. So I used the subject guide for economics. So this provided me access to databases, some of which I had never heard of before. And when I was starting my project and I didn't know where to start to look for papers for my background, this was so helpful to me as I was trying to learn more about my topic. So the 3 main databases that I used were Econlit, Google Scholar, and Scopus. And so Falvey provided me access to articles and journals, which I otherwise would not have had access to, and these provided the foundation for my research. I also found Falvey's how-to guides to be very helpful, especially their citation guide. Citations have never been my strong suit personally, and so having how to do them laid out in a 1 to 2 page, very simple to understand way was very helpful to me as I was completing my project. So I just talked about how I used Falvey's Resources to help with my literature review. So I wanted to show some of that literature review below. So these are not all of my sources, but these are a selection of some of them that I thought were very helpful to my project. And so in my project, I pursued 3 strands of literature review. The first is about lockdown policies. The second is about demographics. And the third is about the differences between industries. So I'm not going to go into detail on all of the findings, but I wanted to highlight, for example, in my literature review on demographics, I found in many studies that income was the demographic variable that was most highly correlated with COVID. So I wanted to be sure to include that in my presentation, and I wouldn't have been able to do that without the background that was provided to me through Falvey. So now I want to move on and talk about my model. So this is the model that we employed in our study. It is a linear regression model. And so we ran this for each of the 4 states in both months. So we ran it a total of 8 times. So to break this down, on the left-hand side, we have mobility. So mobility is the change in the number of visits to a given location in a given CBG, in a given county, in a given industry on a given day. And so this is our dependent variable. So moving on to the right-hand side of the equation, alpha 0 is a constant. Alpha 1 is our lag of mobility. So we are looking at how mobility in the period before affects mobility in the current period. That's what that means. Alpha 2 is our policy variable. So we are looking at how the number of locations open in the period before affects mobility in the current period. Alpha 3 is our demographic variable. So we are looking at how our 3 demographics, income, age, and population, affect mobility in the current period. Alpha 4 is weather. So we're looking at how temperature affects mobility. Alpha 5 is the lag of weather. So we're looking at how temperature in the period before affects mobility now. Alpha 6 is our weekend variable. So we're looking at how whether a given day is a weekday or weekend affects people's mobility. Gamma is our industry fixed effects. So it controls for differences between the industries. And sigma is our error term. So we ran 2 types of regression models. OLS, ordinary least squares, which is what you think of when you think of a standard regression model. That's what I showed in the previous slide. And then the other model that we ran is instrumental variables, or IV model. And so we ran that because we were worried about potential reverse causality problems within our model. So we're looking at how people's mobility affects we're looking at how the number of locations opens affects people's mobility, and we don't want to see how people's mobility affects the number of locations open. So we instrument the first lag of locations opened with the second lag in order to rule out any potential reverse causality and see the true correlation between the two variables. And we focus our estimation on 2 months, March and August, because March was when the pandemic started, and August was the most recent month with data available when I started this project in September. So to talk about my data sources very briefly, all of my mobility data comes from SafeGraph. SafeGraph is a company that tracks people's mobility through their smartphone and aggregates it to a CBG or census block group level. My policy and industry data comes from Homebase. So Homebase is a company that helps over 10,000 small businesses do their employee scheduling, track their timesheets, do their hiring process, and more. And so these are the 8 industries that we are using in our study. Our demographic data comes from the US Census Bureau, and our weather data comes from the NOAA, or National Oceanic and Atmospheric Administration. So now to talk about my main findings, we find that the effect of mobility depends largely on the type of industry. So for example, in March, we found the largest effect on mobility was in Pennsylvania. And so a 1 standard deviation decrease in locations open corresponds to a 1% decrease in mobility in Pennsylvania. And then in August, we find the largest effect of our locations open variable in Maryland, but the effect is actually negative, which is opposite to what we expect, because that means as places closed down, mobility actually increased. But we realized that of the 8 industries that I mentioned in the previous slide, only 4 of them were present in Maryland, whereas the 8 were present in Pennsylvania. And so one of them was healthcare and fitness that was present in Maryland. And so that includes places like hospitals and doctors' offices. So we believe that because we were in a global health crisis, people were still going to these places even though they were shutting down. And so that's why we see the opposite effect of what we expect to see. Our other important findings were that we found temperature had a larger effect on mobility in March than in August. We found that policy is more effective at decreasing mobility in March than in August. And we found that for most states, people are more mobile on the weekends and the weekdays. The one exception is New York in August, where we found that people were actually more mobile on the weekdays. And we believe that this could be due to lifestyle changes from the pandemic. So I wanted to show you all my results tables. So these are the results tables from the results that I've mentioned in the previous slide. And so all of the stars indicate significance at the 10%, 5%, or 1% level. So as you can see, a lot of our variables in our models are highly significant. And the second variable, locations opened, is our policy variable, which is the main variable that we were concerned about within our study. So in conclusion, we find that changes in the percent of locations open have the largest positive impact on mobility in Pennsylvania in March. We find that they have the largest negative impact on mobility in Maryland in August. We find that the type of industry plays an important role in both results. And so we believe that our contribution to the literature is that we are the first one to study these 4 states and these industries in detail, especially by using data at a county level and a daily frequency. This makes our study unique to other studies that are currently out there about COVID. And it's important to note that we see mobility as a proxy for economic activity. And this gives us information about how economic activity might be impacted by the COVID-19 pandemic. And if I were to expand my research in the future, I would want to add more demographic variables. I would want to have a different time frame. So now that we've been in this pandemic for a year, it would be very interesting to compare this March to last March. And I would want to either use more or different states within my sample. So this concludes my presentation. I want to thank my advisor, Dr. Young, for all of her help throughout this project. And I want to thank Falvey for selecting me to be one of their 2021 scholars. And thank you so much for listening.
Thank you very much. So I'm going to kick off the questions. Your topic is a very complex one. There are so many aspects, and you mentioned, you focused on these. How did you go through that selection process to decide which pieces of data to use in your analysis?
So I think that what we were trying to do was think of variables that would have a large impact on mobility, especially in the COVID times. So that's why temperature became included, because we realized that something like temperature can impact whether or not people choose to leave their homes. So we wanted to make sure that we controlled for that within the study. Demographic variables, other studies have found that demographic variables have had an impact on people's mobility. And so we wanted to make sure that we touched upon that in our study and controlled for any differences between those. Obviously, weekends versus weekdays, in terms of just having a job or other mobility, usually that changes significantly. So we wanted to be sure to include that. So I think it was just it was more added on as the time went on, but I think that it was just, we need to make sure that we have things that could be affecting mobility within our model controlled for.
Yeah, and just to quickly follow up, so the demographic data that you included, what were some of the demographic factors? Was it just location, or was it other things as well?
Oh, yes. So we had three. We had total population, age, and income. And so we actually found significance for income in New York in March. So income had a negative coefficient. So what we found was that people that have lower income are more mobile compared to people that have higher income. And this is consistent with other findings within the literature, which have also found that people of lower income tend to have higher mobility. And this is usually because of the nature of their jobs. So for example, like industry, like service work, like working at a receptionist or as a waitress, those jobs aren't ones that can be easily translated to an online setting, where usually higher paid jobs such as lawyers or consultants can easily be translated to an online setting.
Thank you. So we had a question about what are your future plans? Are you going to be continuing this research? What are you thinking?
I hope to continue this research. We hope to try and publish this research. We are still working on finalizing and working out some of the details, but that is hopefully in the future for this project.
Now, certainly from your presentation, it's clear there's a lot more potential from the analysis you've done so far. I'm just checking something else is coming. So how can we use your findings going forward to inform policy and practices?
So I think that something that we found was that, for instance, people were still more mobile on the weekends than the weekdays, even though lockdown policies were put in place. So I think that maybe trying to put more policies in place that targeted specifically something like mobility, something that people would be more likely to be more mobile on the weekend than the weekdays, could be something that would possibly be helpful. I think that looking at the different industry policies, we saw the largest effects in Pennsylvania, whereas other states like South Carolina, their policies did not have much impact on mobility. So I would suggest for states like that, they would try to put and implement stronger policies in place in order to reduce people's mobility.
Okay. Well, thank you very much. It was really interesting.